It's spring, so many of us, like myself, are suffering from seasonal allergies. But this year, that scratchy throat, runny nose is being accompanied by a dose of fear. So how do you know if it's allergies or if it's something else? Joining us now is Dr. Jason Lee of the Toronto Allergy and Asthma Clinic. Doctor, thank you so much for talking to us today. What do we need to know about the symptoms of allergies versus the symptoms of COVID-19?
Oh, hi, Ben. That's a very loaded question right now because it's a very difficult one to answer because patients can present very atypically. But essentially, the first question you want to ask in the climate of COVID-19 is, do people have a fever? And if you have a fever, most patients with COVID-19 had a fever, but patients with allergies should really not be having a fever. So up to about 98% of people with COVID-19 had a fever, but as you know, a lot of people present atypically without much symptoms, so it's really hard to tell. But that would be the first question that I would ask myself.
Continue. Second question.
Yeah, go ahead. Second question is, do you have shortness of breath? About half the patients, or a quarter, or maybe a third, had at least some degree of shortness of breath. Usually in allergies, you don't have shortness of breath unless you have allergic asthma. Again, that's where the nuance comes in. The third question really is weakness, fatigue, myalgias, arthralgias. Really, if you have allergies, you shouldn't be getting the chills, bone pain, or you shouldn't be getting the aches. Whereas in COVID-19, you are about 50% likely to have these symptoms. And if you really get into really the granular details, headaches, sore throat, are found in colds and flus. But interestingly, that if you have really bad allergies, this can also mean that you have bad allergies.
Doctor, because we're living in a world of COVID-19, should allergy sufferers do more to treat and prevent allergies this season than they otherwise would have done, say, last year?
Patients with allergies typically know their pattern of what seasons they react and what seasons they have symptoms. And if you've had a strategy before, I would continue the strategy that you were having before to try to manage your symptoms. So we're really looking for a change of symptoms or a worsening of symptoms that would indicate an infection. In terms of medications they can use to treat, just continue what you've been doing before, including antihistamines, nasal steroids if necessary, and other over-the-counter things that you can try to kind of smooth out the symptoms. But in terms of more or less, it's hard to answer.
Lastly, doctor, are allergy sufferers more at risk for respiratory illnesses like COVID-19?
Allergy patients are generally more predisposed to developing asthma, and with both allergies and asthma, they're more likely to get infections in general. So, we are not really sure if this was captured in the information that was coming out of the centers that were looking after COVID patients. But yes, in general, infections are more common in patients who have allergies. So you have the conditions that set you up for having an infection.
Dr. Jason Lee, we appreciate the insights. Thank you very much.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.